little person in the background. That's my son. All right, welcome everybody, and thank you so much for taking time out of your busy days to be here with us. My name is Veronica. I am the sourcing specialist for our talent acquisition department at UHN, and this is part of a speaker series that we've been trying out for the last little while. I think we started back in September last year, where we are hosting different Let's Talk sessions. And this today's is actually Let's Talk Nursing in GIM, PESU, EDP, and ED. And that stands for General Internal Medicine, Psychiatric, Emergency Unit, and Eating Disorder Program, and Emergency Department. Unfortunately, our GIM colleagues had to bow out last minute, which is, I'm so sorry about that. For those of you who are interested in GIM, we will be hosting another one in the future, and we'll be inviting them back to speak. But you will be hearing from me a little bit about UHN and what you can look forward to as an employee at UHN. You'll be speaking with Aideen from the PESU and with Renee from ED. So let's get going. So just to give you a little bit of a snapshot of what UHN is, we are 4 hospitals with 9 physical locations. One school, which is we acquired recently, not recently, and it's the only school that is associated with a hospital. So that's very cool because we get to shape the future learners of our healthcare system. We do have 7 amazing research institutes, 9 centers of excellence in education, 10 clinical programs that we focus on, 2 foundations, one of which you've probably heard a lot of and probably have purchased a ticket to win a house. And we do a lot of great partnerships in the community, such as Optum Health, Healthcare Human Factors, Plexus, and Grand Challenges Canada. So I'm pretty sure that if you are interested in UHN and have at any point seen us in media or have read our stories, our biggest goal at UHN is a healthier world. That is our vision, and our purpose is to transform lives and communities through excellence in care, discovery, and learning. And along with that, we have values and principles that we really live up to. Back in 2015, we had 150 staff, nurses, doctors, patient partners, volunteers all come together on one day and sit down to really determine what it was that UHN valued the most. And at the end of the day, we discovered that obviously our primary value is that the needs of our patients come first. And because of that, we subvalued it as well. And we like to use a lot of I language. So our values of safety, compassion, teamwork, integrity, and stewardship, when we are at orientation with our new employees, we really use the I language, like I am compassionate, I believe in teamwork, I am a steward, because when you take it in for yourself, you really do believe it, and you know that it's going to be part of your values as well. And that was that photo that you see there was the launch of our PVPs. And that's me and my team having a little bit of fun with our PVPs. So you might be asking why UHN, why choose it as a career or a place that you want to come and study and learn. And just to give you a little bit of an update, we have over 16,000 employees, 3,100 volunteers, and 8,000 learners every year. We are the largest hospital network in all of Canada. We are the #1 hospital for research in the top 40 of Canada. And our Toronto General Hospital actually came 4th, I believe, for the 4th year in a row in Newsweek's World's Best Hospitals. So we're not shy about bragging about all our wonderful accomplishments because we have such wonderful people that work for us, and we know that our people are our biggest asset and value. Being #1 Canada's top hospital just gives you a little bit of a rundown of, what it takes to be #1. It takes that many scientists, students, and support staff. Because of that, they're able to put out so many publications and receive so much money in funding. And that kind of just lists a little bit of what our research institutes are here at UHN. A lot of people don't know it, but like even at Toronto Rehab in the basement, there's a $35 million research facility. Which is amazing, and they do tours. So if you are interested, please look up IDAPT and SEAL. And there's a great video Rick Mercer went and did a video there that, like, shows some of the research that's being done. So we're doing amazing things, and it's one of the reasons, well, it's the top reason why we're #1 in Canada. Here, and because we do like to brag a little about all the wonderful things that we do. Here are just some of the things that we are really proud of. We did come in 3rd place for Diversity Champion in 2021, according to LinkedIn, which was really great. We were Employees' Choice for Best Place to Work in 2020, and we are part of the Career Directory for New Graduates in 2022. We are 2021's Canada's Greatest Employer, which is very cool. We won an award for it, and we've won awards for the Healthcare Climate Challenge. There's some really great statistics on the great stuff we've done green-wise, but I'll share that a little bit later. But if you are interested in like understanding a little bit what it is that our people do, we have 2 very cool podcasts, Behind the Breakthrough and Science in the Six, which you can find on any of your podcast players. And it's UHN staff talking about all the wonderful things that they've done, and how we're helping to shape tomorrow's future in healthcare. So definitely check those out. So here's a little bit about another reason you could join us. A lot of us are really big into climate change and being able to help our Earth, and recognizing that we have to make a change now for the generations that are coming up. So if green is something that you really admire and that you really value in your life, UHN's pretty green. We don't only have the 3 R's, we have the 5 R's, and we try to live by them. Our green team consists of over 731, I believe, members of Team UHN who get together monthly. During Earth Month, which is next month, they do events spread across all the sites. And we're always looking for ways to make UHN even more green. So we've had some really, really great things. Like, we actually last year reduced our water usage by 19%, which equals 55 Olympic-sized swimming pools. And I don't think a lot of people realize the kind of stuff that you can do in a hospital to make the world a little bit cleaner. We've introduced 204 bike parking spots and biking garages, which is a great program. We also get a discount through Bike Share in Toronto. We have like biking groups, walking groups. We have groups that go out at lunch and do collect trash during lunch in our community, in our neighborhood. And we're trying to encourage people to go green when it comes to their vehicles. And we have 42 electric vehicles charging stations at our garages, which is awesome. And as you can see, we've actually earned quite a few awards, and that's our wonderful green team leaders there holding some of them up. So we're very proud of our green team. Another thing that we are very, very proud of is our respect, civility, and professionalism in the workplace. We take this kind of stuff very serious at UHN. We don't tolerate any bullying. We do not like anything that makes somebody feel unsafe in their workspace. So we do offer an e-learning course, and we do have mediation services, and these tools, for example, that will help you with your education and your self-care. And if you ever need to bring something up to somebody, you can always reach out to the mediation team. We do a lot of training around caring safely as well. And that's to help us with preventable harm and keeping our prime value of safety in the workplace. So that's something we very much enjoy and look forward to. And another thing that you can do with UHN is you can grow. One of the things I usually say when I'm doing new employee orientation is I've been at UHN for 11 years. And the reason is because I never have to go too far from home if I want another experience. I've been very lucky to work at 4 different sites in 3 different roles, and I never really had to go anywhere else. I've had educational opportunities and leadership opportunities. And there are, committees that you can join. There's so many great things that you can learn and do and grow with UHN. So we do have over 100 classes in our learning calendar, and they're virtual, some are in person, and some really great ones is like our project management course, which is a full day program, and emotional intelligence, which I thought was amazing. We do offer tuition assistance once a year. There are scholarships for our children and volunteers. And a biggie is that you can get 25% off all your courses at Michener, which is really great, especially for nursing if you are looking for a critical care course, for example. And there's plenty of leadership development opportunities. So we have programs like Lead Up, Emerging Leaders, New Leader Orientation, and Courage to Lead, all of which are free programs that employees can apply for. And it looks great on a resume, and you really do learn some really great things. I am just in the Courage to Lead program myself, and it's taught me to think a really great and different way. So it's a great way to connect with the UHN community as well. And part of our total compensation package is understanding the quality of work-life balance at UHN. So we not only, when we talk about total compensation, we do talk about your hourly wage or your base pay, and what it is that, your union, your insurance plans, etc. But there are many other things that come with your total compensation package. And this is a screenshot of all the wonderful things that we are working on and have implemented. So you, as part of a hospital system here in Ontario, you get to your benefit plan and your pension plan is through HOOP. And HOOP is really great because they contribute 126%. So for every dollar, they'll put in $1.26. And even if you were to start working at another hospital and then come to UHN, you can bring HOOP with you. You don't have to remove the money. So HOOP is a really big plus. Of course, we have extended healthcare coverage, dental and vision, life and disability insurance, all the good stuff. We work very closely with our staff about flexible working arrangements. Sometimes not so easy when you're a nurse and you're on shift, but definitely something that can be discussed, I'm sure. But as you imagine, most of you are frontline, so you will need to be on site. We do have lots of different leaves, which I'll go into. And we have put a lot of work into mental health, especially during the pandemic. And we actually do have a one-time bonus this year for mental health resources. But it's something that we have our EAP for. We do Bright Moments, and we have great on-site massage therapy and gyms and stuff that you can definitely attend to. So please keep that in mind. As for leaves, we do have our regular parental leaves that are topped up to 85%, which is really good. 5 family days off for any family responsibilities, personal and emergency leaves such as bereavement. If you need to take a bereavement leave, for example, you get 3 days off. And other benefit programs, as I mentioned. There's a cute little video right there in the corner that you can feel free to watch on our LinkedIn page that explains all of them. A little bit better than I am right now. And one of the last things I want to show you before we get into it is that we do have some perks for working at UHN. When you're a large organization, there are other organizations that want to work with you and they want to thank your staff. So one of the really great things that we have is staff appreciation events. Pre-COVID, we have barbecues, ice cream carts, etc. We did receive meal vouchers from the foundations when it was pandemic to kind of help our staff not have to leave the hospital. We do get 10% off at gift shops and pharmacy. And we have added value benefits, which means you get discounts at some of the, for example, we put some photos there of the places you can get some discounts on. And one really cool thing is that we have so many wonderful committees that if there is something that really speaks to you, you can meet people, do it on the side of your desk, and it really makes work a little bit more fun. So that is my portion. I'm going to stop sharing and I'm going to be sending it over to our speakers. So the first person who's going to be speaking to us is, I believe it's Lisa, right, Lisa?
I believe so. I've just lost my screen, so
no worries. I'm going to.
Okay, here we go.
Wonderful. Okay, so did you want me to? I'll share the presentation. You're cool with that?
Yeah, but I can't see it right now. So let me. Okay, here we go. Full screen. I can't see the presentation.
Let's see.
Oh, here we go.
There we go. Okay, that's the wrong one. 1 second.
Okay.
Thank you.
I'm going to turn my camera on. And now I can't see the presentation. Okay, that's weird. Can other people see the presentation?
Does anybody see it? I don't see it either.
Okay.
Okay.
So you're controlling that for me, right?
I am. Yes. One
Okay.
second.
Okay. Okay. So
Wonderful. Okay.
first, I'll start by saying welcome and thanks for taking some time out of your evening. My name is Lisa Crowley. I'm a nurse manager, and I'm very proud of that. I have to say, and this year it's 30 years I've been a nurse. That I have UHN is the first time I got to call myself a nurse manager. I've been clinical leader manager, clinic manager, all of those things. But I take great pride in the fact that I am a nurse and that I work at UHN. The first part of my presentation is going to focus on an area that I actually don't manage, but I do want to tell you about it. It's called it's PSU, short form. It's our Psychiatric Emergency Services Unit. It's located in the Emerge. So for those of you who are attending who understand or have been in the Emerge environment often, people will come in, they might get seen as somebody who needs an assessment by psychiatry. And so that is our version at UHN. It's the PSU, or Psychiatric Emergency Service. It's located at Toronto Western. It is an environment that's contained within Emerge, but solely focused on psychiatric services and the assessment of people who might be in crisis or needing a psychiatric assessment. That team, when somebody comes in, is actually 6 beds, we call it, but it's an emergency room. People don't stay there. So 6 beds, 3 nurses. So it's about a 1-to-2 ratio. It's a 24/7 service. And those nurses we do the training. So just so you know, you may not have psychiatric or mental health experience. This would be something we are doing training for individuals. I can tell you that I didn't start off in psychiatry. I started off in HIV 30 years ago, and actually was drawn to mental health because I realized that everything I was doing led back to mental health. So, it doesn't matter whether you work in GIM or where you work in a hospital or as a nurse, mental health will actually be one of the core pieces of the work you do. Next slide, please. So it's a team, it's multidisciplinary, it's not only nurses, it may be mental health clinicians. We're a teaching facility, so the residents, medical students, social work students, all of them work to conduct assessments and interventions for each patient who walks through our door and come up with a plan so that they can they either need to be admitted or they can be discharged safely with a plan for follow-up or a plan back to their community provider. We do have linkages within our own hospital, and then we are linked on a sort of larger level within the GTA to other mental health services. Just looking at the slides, as I said, not everybody who comes to see us actually needs to be admitted. Sometimes it's just they need to chat with us, make sure they're safe, and can be discharged back to their treating facility. Next slide, please. Okay, so within mental health nursing, and this is going to apply for the next part of my presentation, is that we're continually educating ourselves. There are mental health competencies. There is something called the CNA certification exam. So people who actually want to involve themselves in mental health services as a nurse can do a CNA certification exam. We support that. Within PSU, we're going to do things like we're going to do a mental status exam. We're going to do a suicide assessment. One of the biggest things we do, people may come in with the police. They're highly escalated. What we will need to do is develop a therapeutic relationship with them. If we can, it's very short. It's very intense sometimes, our interaction with them, but we want to de-escalate them. I didn't mention that I also have a background. I work part-time at CAMH in the emergency room. So I know this firsthand as a nurse, not as a manager, but as a nurse. These are pieces I've done. Everything we do comes with a trauma-informed care or recovery lens. Understand that people have trauma. They come to us with lots of things that may have happened to them in their background. We don't want to, bring that up where it's not necessary and it's not part of our planning purposes. We also want to come with a recovery lens. Not everybody wants to be on medication. Not everybody has the same goals as us. So allowing and supporting patients to make decisions that are within, what they want. So it may, sometimes patients are going to go out and use again. That's going to make them sicker, but it's not our control. And so, understanding that every patient we see, we're going to see them through a trauma lens, a recovery lens. Part of the education is understanding the Mental Health Act. At what point can we actually hold a person? We may see them as quite unsafe, but, do they actually fit the criteria to be held against their will in a psychiatric service or in a hospital? We use things like understanding the various mental health illnesses, using CBT, which is cognitive behavioral therapy. So using those techniques to interview people, and also for motivational interviewing. So understanding people and how do we interview them that allows them to focus on their strengths. We do have a strong preceptor model, and a lot, I have to say, in all my years, the onboarding and education we provide to all nurses, not just new nurses, somebody who's just a new grad, but a nurse who may be coming from another area. We are very strong in making sure that nurses have the skills and the onboarding that allows them to be successful. And it's not the same for everybody. We do a lot around crisis intervention and just situational awareness to keep ourselves safe and keep patients safe. One of the things I'm proudest about at UHN is we do not only deal with the mind, we deal with the body. So a lot of services you'll see, a lot of mental health areas at other hospitals. Well, they've got an IV, can't possibly take them. They have a wound, we can't possibly take them. They need blood work, can't take them. We actually treat mind and body. So one of the skills you would be working on is you will keep up your phlebotomy skills. You will be doing physical assessments. We have to actually know that the person doesn't have some underlying physical condition that actually puts them at risk. So we want to ensure that we're actually seeing all of the issues, whether they be mental health or physical, and dealing with them both. And leadership mentoring, I have to say, I'll get to it more when I talk about my unit, but I can tell you that I have, in my short time, we're watching people. We have a large number of people doing their masters. They're doing their CNA certification. I'm losing them, but I'm losing them to opportunities within the hospital, which, while it frustrates me that I'm back on track to bringing new people on, I'm very proud of the leadership that the staff that we have are providing around mental health in the hospital, whether it being a CNS, whether it being working on with a transplant. These are all places that nurses who have worked in mental health have gone and moved to once they get their skill set down. And so next slide. Just a picture of the team. You have to have one. One of the key people in there, so Mo is the nurse manager right in the center. That's Mo. The one on the far left, that's a learner. No, that's Aideen with the red hair. That's a learner. And the one on the far right is Aideen. And Aideen Carroll is an advanced practice nurse educator. She came from Ireland. She was a nurse there and had to start from the ground up again when she made it to Canada, and she worked in various environments. She is a mental health nurse through and through, and her passion is making sure she supports nurses on their journey to become better nurses, and particularly better mental health nurses. So if you were to come work with us, that is somebody you will know very, very closely. She is the go-to gal for all of our services in mental health. Next slide.
5:28 p.m.
I don't know who that's talking. Okay, so now we have a presentation on my next unit. Veronica?
Sorry, I am just looking for it. It seems to have.
It was in the same email I sent you, the second slide deck.
Okay.
Yeah.
For some reason, I closed it by mistake. So
that's okay. That's okay. And please, if anybody has any questions, please put up your hand, turn on your screen. I find this, as a mental health nurse, I find this sort of environment a little daunting, because I am a person who develops relationships and I like that piece. So I struggle with this sort of.
All right, I think this is it, Lisa.
Yep. That's it. Okay.
All right, we're good to go.
So I am the manager on 8 Eden South, which is our inpatient mental health services. This is just a picture of the entrance, little waiting area, the typical sort of secured area. We are a 34-bed unit. It's an interprofessional community. Like I said, we have nursing students and medical students and all sorts of learners. We have OT, PT, social work, RNs, PSWs. We're focused on providing evidence-based care. So it's not, the old, if I go back 30 years, it was talk therapy. And as a nursing student 32 years ago, you just sat with patients and smoked. That's how bad it was. That is not how it works now. Within our unit, we have 6 beds, which are called our Psychiatric Intensive Care Unit, or PICU. And that's a unit within the unit which is focused on the individuals who need the highest level of observation and supervision. So people often come from PISU, which we just talked about, into our PICU, because we're still getting to know them. We still need to know that they're safe. And this is our highest observation level. Out on the ward, so the rest of the unit, so we've 34 beds. I've talked about 6, I have 28 more I got to figure out. 5 of those are psychogeriatric patients. 13 are mood, anxiety, and psychosis. So, and substance. It's called our MAPS program. And then the last 10, which seem to be left off here, last 10 are our eating disorder beds. Anybody we bring onto our unit as a new staff gets trained across that. And we will do it in sections. We train people first for our mood, anxiety, and psychosis. Then we go to our eating disorder. Then we go to PICU, because over your orientation, it would be all 34 beds. However, it's divided up. We don't want to overwhelm people. We want people to sort of get to know the nuances of a different population before we sort of give them something else to pick up on. The basics are around the mental health assessment, suicide risk, understanding the unit, that sort of thing. But then we work to give people shifts in those various environments. It's all together though. It's not like it's, eating disorders is over here. And yeah, it's 34 beds altogether. The only ones that are sort of divided out are those 6 PICU, and they're actually, it's a secure area within our unit. Next slide. I think I mentioned this. It's OT, it's, psychiatric nurses, the term there, we're all nurses, but do we have the skill set to work as psychiatric nurses? Not everybody does, but we work to train our staff to be competent and safe and to do the best they can. Psychiatrists, we have a recreational therapist. She is great at getting people going. It's hard. You're locked on a unit. She does amazing things with patients to keep them engaged and active. very vital part of our team. Wish I had 2 of them. Social workers, we have, we're going to change that. It's not psychiatric assistants. They're actually PSWs. I would call them program assistants. They're folks that work with us hand in hand. They deal with some of the more physical health issues. If somebody needs a lot of help with their ADLs, and we all work as a team. We're conducting assessments and interventions that are focused on each and every individual. And again, we are really focused on, that recovery philosophy, understanding that's trauma informed, and also behavioral activation. We want people, where appropriate, to get up and get moving on our unit. Last slide.
Lisa, you've gone mute.
Okay, sorry. No, I'm back off. So one of the things I'm most proud about, we talked about this, is we do venipuncture. I actually have a part-time job somewhere else, and I was working yesterday, and the person said, I'm worried about working in mental health because I'm going to lose my skills. And I said, oh, you won't at Toronto General, because we do venipuncture, we're doing IVs, we're doing PICS, catheterization, bladder scanning. These are things you won't see on mental health in other facilities. And we're very, very proud of that. We're looking at the opportunity for building a psychiatric medical service, which would be the only one in Toronto. We do blood transfusions, NG feeds, O2. These are things you will not see at other hospitals, and we do them. So there's no fear of, if you are a new nurse or even a more seasoned nurse, you will not lose those basic skills. We value them, and it's so important to our patient population. Next slide. Oh, we're not going to, I'm not sure why all of this is there, but these are things we do. Yeah. Okay. So the big thing, we're back to therapeutic communication, or the relationship, building that situational awareness, understanding how we build a relationship with people quickly, and also an awareness to keep ourselves safe, our patients safe. There's a lot here. Okay. Assessments. We do things like the mental status assessment. We do suicide risk assessment. We do a DASA on every patient. So that is a way of predicting if there's an opportunity for somebody to escalate or a concern around safety. So we do those DASAs every 24 hours. And learning how to assess mental health forms, knowing if they're correct, if they're lapsing. And I also mentioned suicide assessment already. Next slide. Oh my goodness, I think I sent you the wrong slide deck. Okay. So in orientation, we talk about addiction, anxiety, bipolar illness, depression, schizophrenia, eating disorder. This would be all part of orientation. Next slide. Is that?
I got.
Oh, okay. Okay, so my apologies. The slide deck, I thought I had fixed it. I sent you the wrong one. I just want to open up. Are there any questions? Don't be shy.
Yes, don't be shy, please.
Oh, Fiona.
Hi, Lisa. Thank you so much for your insightful slideshow and presentation. So you've probably been aware about the new change of competencies since 2020, with nurses being granted the ability to perform CBT without an order. So would you have any recommendations as to how like a student like myself could go about that, researching what certificates are accrediting that?
Yeah, so it's unfortunately, we're not in that place right now at UHN, but we're getting there. So within our group, we use CBT, I'm going to call it CBT Lite. So the opportunity to use the principles, but we actually can't say it's not within the scope of the nurses. And it's not within the job description right now, but we are looking at how we can change that.
Thank you for your answer. I look forward to as that changes throughout the years.
Yeah, and you know what? Please reach out. If you have questions, Veronica can connect us totally one-to-one.
Absolutely. Yes, I can. If there is anyone else who wants to unmute themselves, or you can put your question in the chat.
I'm going to take myself off screen because I've been sitting here with staring at a nobody for a while. So I'm taking myself off. I see the next presenter is up and ready, and I'm not seeing any other hands. So I am going to assume if you hear anything from, if anybody here wants to reach out to me, Veronica can connect us. I hope you will consider mental health. We'd love to have you. I'd love to have that discussion about what it can do for your career, and whether it's a change or a start. Please reach out.
Thank you, Lisa. We will be giving you guys some details later on in the presentation about an upcoming job fair we have. So you may be able to work with Lisa, and Lisa's wonderful. So we hope that you will attend that as well. So we're going to be moving on now to, I believe, ED. Renee, are you there?
Hi, it's Janet, the manager. Can you hear me? You have the presentation. And I'm trying to, so if I'm muted, I'm trying to, oh, there I am. Sorry.
No worries.
They came and took my desk away today. I'm getting a new desk tomorrow. Very exciting, but totally miscombobulated me. So hello, everybody. My name is Janet Pogram. I'm the manager of the emergency department at Toronto Western Hospital. So UHN, let me just switch the picture off, sorry. UHN has two emergency departments, one at Toronto General and one at the Toronto Western site. And I am the manager of the emergency department at Toronto Western site. We both departments work very collaboratively together, a lot of standardized processes and protocols, and our provider group, which are our physicians, our MPs, and our physician assistants, they work at both sites, but the nurses are assigned to either or department, but there is a little bit of crossover. We started to cross over a little bit due to the nursing shortages, and mainly it's the general, we're just starting that, and mainly it's about overtime. So we're not moving in the model where we cross over with our nurses, but just there is opportunity there. So let me show you our slides, and then I'll talk through it. So why, as a new grad, would like to come to the emergency department? So historically, I have been at Toronto Western for over 30 years. My whole career has, originally I came from England. I was here for a year on my way to Australia. I never got to Australia, but I did work in the emergency department as a bedside nurse for many years, and then went up to general internal medicine and developed my leadership within general internal medicine. I was a patient care coordinator, a manager, and then came back down to the emergency department as a manager. So within UHN, you definitely can grow within your career, go to many different areas and many different positions. So definitely we do serve a very important part of the downtown Toronto core, with two of the acute hospital sites, which is Toronto Western and Toronto General, sharing a portion of our population, but also there's unique subsets of the population that will come to the Western, and then will also come to the Toronto General. So here in the Toronto Western Emergency Department, we are an interprofessional team, and that is composed of registered nurses. We have just started with a program for our registered practical nurses, working to full scope, and that began a few months ago, and it has done very well and integrated very well. We have unregulated healthcare providers. As I said before, our providers of physicians, nurse practitioners, and physician assistants. We have social workers and geriatric emergency medicine with geriatric nurse specialists. We have been approved that we will be moving in the next few years to build a geriatric emergency unit attached to the emergency department that will then serve our geriatric population, and very exciting news about that. And we have our peer support workers. Now, peer support workers are people are actually employees of the hospital, and they have experienced life trauma and the experiences of homelessness, also substance abuse. And with those life experiences, they have been able to overcome and are now employed in the program within the hospital, and it's in partnership with our community services. And really, they are able to connect with a subset of our population because they have experienced what the population are going through at that moment. So if that is our our patients that are living in shelters, or they're homeless, or our patients that are in substance use, they it really can connect at a different level. And it really does provide our patient with a deeper level and connection. And they're able to connect with our patients to the shelters and to systems out in the community. So in the ED, we are a 37-bed acute bedded facility. We have 22 physical monitor beds. We are a regional stroke center. We've just recently got stroke distinction from Accreditation Canada. We are a leader in neurological emergencies, plastic surgical emergencies, and we provide care for the subset of our patients of cardiac, neurology, orthopedic, ophthalmology, general internal medicine, and general surgical, and mental health. As Lisa has said, with the PESU is attached to this Toronto Western emergency, and a lot of the patients that she was explaining and describing with a mental health crisis coming in with police and requiring assistance coming through the emergency triage into the PESU. So we work very closely with our PESU colleagues as well. Next slide, please. So we have our department is split up into 3 major areas, and then with our triage area as the gateway to the department. So in our acute area, we have our resuscitation. There are 11 beds or cardiac monitoring in all rooms, and this is where our most acute patients come. So we give life-saving medications, inotropes, arrhythmias. We have a lot of neurosurgical and small amount of trauma, but they do come. We may have to send them out to the major trauma centers, which is St. Mike's in Sunnybrook here, but we do have training within first level trauma. We care for patients with cardiac pacing, acute strokes, respiratory failure, seizures, and altered mental status. And in this area, the nurse to patient ratio is 1:3. Next slide, please. The subacute area is next area of our acute patients. They do require a bed, but they don't require emergent medical treatment. It's an 11-bedded area. All beds have cardiac monitors. These are our patients that we're basically doing the workup on to determine the diagnosis, which are often patients of chest pain, shortness of breath, chronic diseases, also our COPDs, chronic heart failures, and acute kidney injury. Our nurse to patient ratio here is a 1:4 nursing ratio. Then we have the ambulatory area. So we have just, we are under construction. At this present moment, we're into our last phase of construction, but our ambulatory area has been a new and revamped, really changing the way of the flow of the patient so that we can be more efficient with the way that we see the patients in that time manner, and also the care that the patients get. So instead of all being bunched up in one waiting room, it goes throughout the system, the ambulatory care area, and it really, our patients feel a lot more satisfied with the information that they know and the stages that they've gone through through the area in getting seen by providers, going to x-ray, coming back and being reevaluated. This is a 15-bedded area and a 30-chair area. We have one cardiac monitor bed, and that is for our conscious sedation. We take care of what we would call the walking wounded. So, you know, you cut your fingers, you've broke your hand, you've got something in your eye, you know, more so than what your family healthcare team, but not necessarily do you need to be in a monitored bed. We, as I said, orthopedic injuries, ENT, minor burns, and post-operative complications. And here, for the whole of the ambulatory area, it's four nurses, and this is where our complement of our RPNs and our RNs come into place. So there's 4 nurses. There is also an ambulatory flow coordinator, who is a clerical member of our team that actually oversees the flow. And then we have another clerical member of our team who works in the busiest times, from 10 till 7, and they really do help facilities of pulling up when blood work has been completed, or CTs and that have been reported on, and so really helping with that efficiency for our patients. Next slide, please. So one thing that we do have here at Toronto Western site is that we are part of the team that is responsible for our external disasters, our chemical and biological or radiological nuclear teams. We are prepared for that as special teams, and our nurses are prepared. And then we have a special a group of nurses who are on call, and so if there was ever to be any one of these types of disasters, then they would come in, and we do training period of every 2 years. As you can see in the slide, there's the suit that one of the staff are in. We've done many tabletop exercises. We were involved with the Toronto tabletop Code Orange exercise that involved not only was all departments within the hospital, but it was connected to EMS. And we went through what it would look like if there was a disaster. How would we move the patients through? And whilst we did very well, there was also many learnings that we took from that experience as well. And then given now we have the global pandemic, and one of the things is that we've been on lockdown from travel for 2 years, and now everything is opened up. The other day we had a patient from the DCR, and really we had to question, the patient did have malaria, but we had to question, was this with the chance of being Ebola? So there's a lots of different things that we have to put into factoring in when our patients are coming in, and we are prepared as a team to be able to manage and take care of all patients. Next slide, please. This is just a few slides. We do a lot of simulation. We believe that with interprofessional simulation, this is where we learn. The top slide is at the beginning of COVID, when we were doing simulation of having a tent. We had a tent outside for expecting the volumes of patients. And if there was a situation where a patient became medically unstable, and how would we deal with that situation, being that there was a medical emergency and the patient was COVID positive. As we said, there's the picture of someone's finger that's been sutured up. That would be in our ambulatory area. And then down at the bottom area is one of our resources post taking care of a patient. And whilst we, successfully look after our patients, and then afterwards there is a real emphasis on cleaning up the area, restocking, and being prepared for when the next patient will arrive. Next slide, please. Okay, so this is our emergency department nursing pathway. So as a new grad, why would you think about coming to the emergency department? So historically, it was always said that nurses need 2 years or more on other units before coming to the emergency department. But given the COVID pandemic and the nursing crisis that we are going through, we've had to look at things a little differently. And one of the key things is really being able to support our new grads. in our department. So since I have recently come to the emergency department since September, and we've hired a fair number of staff, about 12 new staff. Most of them are new grads, and then we have RPNs. So we've had to look at a very different model. And so aligning with professional practice, we've already outlined how we do our regular pre-orientation and orientation, but we had to go a little deeper in a different way. So we have aligned with professional practice, and that I was able to secure funding for our new grads to be able to do ACLS, coronary care 1 and 2, once they start here at Toronto Western. Also, we have implemented a new role called the clinical nurse resource, which is one of our senior nurses, and that they don't have a patient assignment, and that they are out on the unit really shouldering with our new staff. And there is a resource, but they're also there to really be able to lean on, ask questions, and really support practice. And that has really helped with that transition. We've got about three stages of new orientations going through. Some that have been here for 6 months, 3 months, and a group that have just completed their orientation. And the feedback that we've got from the new way that we are doing things is that they feel very supportive. The information is like any unit. When you first go to a new unit, it is a big learning curve, but they do feel supported, and they do feel that they got a very in-depth orientation. And we do, assign our new grads. There is a stage with all our new orientees that you will go to ambulatory and our subacute area. It isn't until you've been in the department for 6 months or over, depending on how you feel, that you would then go into be independent in the acute area. And then it's one to a year and a half for our triage. And then usually 2 years or more before it's in charge. So there is a career development within the emergency department, but it's done at a staging that you feel comfortable as an individual, and that we work with you. And what we also are looking at is partnering with our Michener, and like the ICU, in creating an emergency critical care course prior to prior to actually becoming independent. We would take this course through Michener. So working on that. So yes, maybe a new grad may be interested in the emergencies department, but please be assured that we seriously have undertaken your educational needs, understanding what you need for professional development within the emergency department, and have created pathways and supports to be able to get you transitioned into the department and to succeed. Next slide, please. And then once you're here, you've gone through your orientation, you're working independently. How do we grow? How do we support growth and development? I think Lisa had also touched on many of these things that we have here within UHN. There's the ability to attend conferences and workshops. We have our CNA certification in emergency medicine. There's definitely dedicated times to engage in quality improvement projects. We've just done a QI project in collaboration as an interprofessional group with our physicians and nursing and our flow coordinators through our ambulatory area. And we did some tabletop exercises, and we're working now. One of our next QIs is about triage times and EMS offload delays. So definitely we are an interprofessional QI approach, and really with the focus on enhancing the care that we provide for our patients. Other awards are, we're fortunate is the, can you go back please, is our Krembil Neuroscience Collaborative Academic Practice Awards. These awards are at Toronto Western only. We have a family that supports our neuroscience program, but it is collectively across the site. And that is, again, encouraging nurses at point of care to do QI improvement projects, and they provide time and money so that you can be off the unit to be able to do the project, and then you present at a Krembil Awards Day once a year. And there's many nursing fellowships through our CAP, and we have our Jill Smirnis Award for Emergency Nursing of Excellence. Next slide is, and then this is just us. We are very much a team. You have to be a team to work in the emergency department. You know, we're busy. We support each other, and we lean on each other for resources and knowledge at times. So pre-COVID, there was a lot of social events. Post-COVID, with our masks on, we still work together, and there really is a lot of opportunity for growth in the emergency department. So my message to you would be, if you are interested in working in the emergency department as a new grad, we do have the education and the pathways and the support to support you in that. And if you weren't thinking about emergency, but maybe you are, please at any time do reach out and we can discuss it further, because it really is a great environment to work in and lots of opportunity for learning. Thank you.
Okay, wonderful. Thank you, Janet. That was very motivating. Even I want to become a nurse now. Does anybody have any questions for Janet while we still have her? Feel free to unmute or to stick them in the chat.
I was going to say, Janet, can I come work for you?
I don't see any questions popping up right now. If anybody is interested in speaking with Janet further, or learning more about our upcoming career fair, I'm going to be sharing that information with you. I'll give it another minute while I bring up my screen. Okay. Okay. So just while we wait for anybody to ask any questions, we do have a virtual career fair that is coming up this Thursday from 1 to 6 p.m. Feel free to register online. I will be sending out an email after this with a survey to see how you guys enjoyed the session, and with the opportunity to register for our career fair. So you will be given a 45-minute time slot between 1 and 6 p.m. and you'll get to be interviewed by a panel, including the lovely ladies we met tonight. You will be asked to send your resume ahead of time to myself so that I can include that in an invite for them, so they're ready to go. And of course, if you know anybody who might be interested in Team UHN, and you know, maybe you guys have a great vast network of other colleagues and students you've worked with that you might think are great. So we want to hear from you, and you can share the invite with them as well. Looks like we do have 2 questions in the chat. We have one from Jaden, who's asking, is there a ER sponsorship program at UHN?
So I'm not quite sure what an ER sponsorship course is. Do we have professional development that you can attend the courses? Yes. Do we have support for your ACLS and your coronary care 1 and 2? Yes, we do. But we actually do not have the critical core emerge course up and running yet, but that would be one of the things that you would be sponsored to do. And the plan is, even if you are new, we haven't quite figured out the time frame yet. Once we do get that up and running, we will be asking you to participate in that as well, or maybe parts of it. Did I answer your question?
Perfect, thank you. Really happy ER is taking new grads, she said, or Jaden said. And we do have one more question. I tried registering for the event on the 17th, but it took me to a Whoops page. Well, thanks for letting me know, Christina. I will definitely look into that right now when we get off the call. And what I'll do is I'll be sending the link to register after anyway, so I'll make sure that that link is working for you. If there are any other questions, please feel free to unmute now or ask them in the chat. If there are no questions, Lisa and Janet are always available for a chat with any nurses who may be interested in joining their units. Yeah.
Hey, it's Katie. Someone did say, there's a question in the chat there that says, I have a question. If I cannot attend the virtual career fair, is there any way that I can pick a different time? And yes. We can make that happen. Sorry, I should introduce myself. I'm Katie Glasgow. I'm the People and Culture Manager who supports both Lisa and Janet and Mo. So nice to meet everybody. But yeah, we can definitely reach out through Veronica and let us know, and we will set up another time to have an interview. Not a problem.
Wonderful. Let me see if there's, oh yeah, somebody, well, thank you so much. You're very welcome, Evelyn. So please do stay connected with us. You can follow us on our Instagram, our Facebook, our LinkedIn. And we host sessions like this. We try to do them once in a while to keep everybody informed of the different types of nursing that we have at UHN. But we do hope that you'll consider the ED and the PESU because these are great areas and they have such room for growth. And they're real areas that I feel like there's a lot of connection there. So
And inpatient mental health.
Inpatient mental health. Yes, sorry, Lisa.
That's okay. Don't forget us.
Don't forget you. Never. So thank you very much, ladies, for joining us this evening, and thank you to everybody who's attending. A recording of this will also go out to everyone who's attended, so please do share widely with your networks if you are interested in, and if you know anybody, please connect them with us. Again, our fair is on Thursday. We hope to see some of you there. All right. Have a good evening, everybody, and thank you so much.
Thank you so much.
Bye.
Good luck. Bye-bye.
Bye-bye.